Hi, I'm Dr. Pelto. I'm going to go over something called my patient presentation. This is the same thing I do for all of my patients multiple times a day in the office. And there's a new addition to it, which I call a treatment sheet. So I'm going to actually start out with the treatment sheet, and then I'm going to go into explain a little bit more with the presentation. So I'm going to click on this treatment sheet. This is something that I put together and I give to my patients when they come into the office, because this is just a high overview of how to treat your plantar fasciitis. So if you look here, um, I usually write the diagnosis in here for the patient, which is plantar fasciitis. When I'm going to see them back. Um, Now, some things you should consider if you're going to be treated for your plantar fasciitis. You're going to need some imaging. We always start with X-rays, and then usually at the second visit, I'll do an ultrasound. And then potentially, if you're unsure what's going on, you're going to get an MRI. There are different categories I like to focus on, and I'll explain this a little bit more in the presentation, but we want to help repair and heal the tissue. You want to reduce inflammation. You want to reduce tightness and strengthen, and then you want to reduce stress and strain in your foot. And I put this in here in this checklist format because depending on what phase we're at, we're going to do different things. To repair and heal, I normally use shockwave therapy, especially if you've had it for a long time and it's not getting better. Maybe you've seen other doctors. Anti-inflammatories, I'll write in the anti-inflammatory. The most common one I use these days is called Mobic or meloxicam because it's once a day dosing, and I find that the less times you need to take something, the easier it is for people to do when I tell them. Icing, contrast baths, cortisone injections, those are all ways of reducing inflammation as well. Reducing the tightness is a big key. I think that's misunderstood. Patients, they just do stretching, 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 and they don't get any better. But there's a lot of other things that you can do called the stretching splint or physical therapy. And then reducing stress and strain on the body, using supportive shoes, anatomic shoes, occasionally correct toes, custom orthotics. There's certain braces that we use at times if it's a real chronic case that's not getting better. A walking boot occasionally, UFOs, which are a special sandal that I like for my patients, and then there's different patient education things. Okay, so these are my notes to the patients. Let's go back to the presentation. So I'll kind of show this to you. Okay, so here is the plantar fasciitis uh, slides that I go over. I talk about how long have you had the symptoms. Why is that important? Well, if you've had pain only for a week or two, the treatments are probably a lot easier. Maybe with some stretching anti-inflammatories, you can get better. If you've had pain for 3 months or 6 months, you've seen a couple of doctors before, it's going to be a little bit harder. I tend to think if you've had pain over 6 months, your condition is most likely chronic and the tissue itself has changed to be a lot thicker. Okay, that's why it's important. What treatments have you tried? I always ask my patients this because if you have tried everything you can buy on Amazon, then there are other things I can do. If you've seen two or three podiatrists or urgent cares and things like that, then you've probably had cortisone injections, other anti-inflammatories, maybe even a night splint. And so it's really what level, what process level you're at when I'm treating you. That's why that's important to know what treatments you've had. How does it impact your life? This is also something that's important. If this doesn't affect you, if it's been going on for 10 years and it doesn't really bother you, you don't have the pain getting out of bed in the morning, you don't have the pain functioning, you might not need to do much. And then why do you want treatment now? So let's talk a little bit about plantar fasciitis. I really like these pictures. It makes it a little bit easier to understand about what is plantar fascia. So first of all, the plantar fascia is this white ligament that goes from the heel to the ball of the foot. You can see it right here. And then also this other picture, this is the bottom. This is all the fascia, all this white area in here. Now, the only area that gets bothered, or not only area, but the most common area is on the heel. Occasionally, patients can get something that's called a plantar fibroma, which is different, which is a little bit further forward usually, and there's little bubbles. There's actually tears that get scar tissue that get really thick. The plantar fascia is a little bit different. The plantar fascia tends to hurt at the base down here where it's red. It's not usually red. This is just as an example, this red here. And what happens with the fascia is it gets little micro tears in there or it gets injured. And instead of healing, it gets thicker. So the tissue itself gets thicker. Now, one thing you have to realize, this white stuff, like the plantar fascia right here and the Achilles tendon right here, they're white. White things, they don't have the best blood supply, very similar to ankle ligaments, very similar to like ankle sprains. You may have heard that an ankle sprain actually takes longer than a fracture to heal. It's the same thing with the fascia or the tendon. If they get injured, it's going to take longer to heal them because they don't have the best blood supply. So you're having this fascia or ligament inserted into the heel, so it's hard to get blood supply to this area. That's one of the really big challenges when treating plantar fasciitis. The same thing goes with Achilles tendonitis. They're both kind of both in the same. If you're going to have heel pain, you're either going to have plantar fasciitis or Achilles tendonitis. That's the most common thing. Why? Because the Achilles tendon, once again, is white, doesn't have the best blood supply. And to make things even a little bit worse is if I have these yellow lines here, it's because if this is tight in the back, so if the back of the calf is tight, which I would say 90% of my patients have tightness, or what we call equinus, which just means you're really tight in the back, that's going to pull more on the Achilles, which is going to pull more on the fascia, which is going to make things get inflamed even more. Okay, so a lot of the focus is going to be on loosening up this area. Now, why do we loosen the calf when the heel hurts? Well, fibrous things like this, these fibers, they don't stretch that well. If they stretched well, they would be red, they wouldn't be white. So the red stuff, which is the muscle on the back, it tends to stretch a lot better. That's why we use the foam rolling and other types of treatments we'll talk about. You can see here in these pictures, this is the diagnostic exams that we do. We always start with x-rays, but x-rays don't always tell us much. It'll tell us if there's a heel spur. Everyone asks, why do I have a heel spur? Well, it's because of the pulling on the fascia over time creates a spur in that direction, but the spur isn't the problem. We don't remove the spur. I find a much better exam is with a diagnostic ultrasound. So here you can see the ultrasound probe. Here you can see the plantar fascia. And here's going to be looking at the thickness. So if you look at this picture up here, here's the probe, here's the fascia. You can see it's not that thick. Usually for a female, it's about 3 millimeters. For a man, it's about 4 millimeters. And here you can see it is thicker and it is darker. So this would show more of a chronic inflammatory plantar fasciitis on the left side compared to the right. It's darker because there is water in there or swelling inside that tissue. Okay, that's why it's darker. That's why I think doing both side ultrasounds is very good comparison. So you can look at the painful side and the non-painful side. This is something that I put together. Once again, these slides, I do it every single day with my patients, so there's not too many slides. There are some links here. So you'll see there's these underlined, and I'm going to go over a couple of those that give a little bit more information. Okay, but so when you're talking about plantar fasciitis, there are certain treatments that are most effective and others that are least effective. Okay, that's something good to know because everyone says, well, can I just lose weight and make it go away? Well, you can lose weight. It's not that effective. Can I just use Voltaren or CBD or some other topical cream? You can, but it's not that effective. So there's certain treatments that are most effective, others that are least effective. Second thing is there's different categories. So you can reduce the pain, you can reduce the tightness, or you can reduce the stress going through your foot. Okay. I always say you can't just do one thing. You have to do kind of a combination of treatments. It's not just a cortisone injection and that's it. You have to reduce the pain, reduce the tightness, and reduce the stress. Most patients, before they come in and see me, they have tried stuff underneath the red line here, underneath this yellow line. So all the stuff in the red, they've tried. We'll go over that. So anti-inflammatories, as I mentioned before, if you haven't tried that, I usually do a 2-week course of something called meloxicam. Icing and contrast baths, so icing for 5 minutes a day, or doing a contrast bath, which are 2 buckets of water. One is ice water and one is hot water. So you do 5 minutes in the ice water, 5 minutes in the hot water, and 5 minutes in the ice water. Topical creams, these are all okay, but they don't usually get rid of people's pain. Then they come and see me. Stretching, I find stretching is okay, but a lot of people stretch wrong. So I'm a bigger advocate of night splint and foam rolling. So usually when you would come in the first visit, I would give you anti-inflammatories, contrast baths. Usually you're going to go home with a night splint or a stretch splint that kind of pulls the foot up. You're wearing that for 3 hours a night when you're watching TV, or you can sleep with it. Doing some home therapy. I like foam rolling. And then you can do some stretching throughout the day if you want. But you say, well, why don't you do like stretching during the day and all these other things? You can only give patients so many things to do. And I find if I give them the night splint for 3 hours, the home therapy, which is like foam rolling for 5 minutes, once or twice a day, that's usually sufficient. And then if it's not enough, then I go to physical therapy. And then finally, patients usually try over-the-counter arch supports. They may try KT taping or taping the foot or compression sleeve That's like a compression sock. You can try those. And if that's not working, my patients usually do orthotics. I'm a big advocate of the proper shoes. So shoes can a lot of times be a culprit. Also home sandals. My favorite home sandal is called an UFO sandal. Has a really good arch support for my patients. And then if a patient's having a lot of pain, I might do a walking boot, especially if I'm doing a cortisone. I might do a cortisone in a walking boot or an amnio injection in a walking boot. And then, so the way I typically do is I start out, like I said, in anti-inflammatories, icing, night splint, foam rolling, and then orthotics and new shoes. That's how I start with my patients. And then when they come back, if they're not getting better, I'll do the ultrasound and that'll guide me towards the shockwave. So let's go to some of these things that are kind of underlined. So we'll start with the shockwave. So when patients come back, based on the ultrasound, if there's a lot of thickness in that fascia, that's where I'm going to recommend the ultrasound. I'm sorry, the shockwave there. So shockwave is this here. So shockwave is this machine that I use that hits the side, actually usually on the bottom, the side of the fascia down here, and it has this little bullet that goes back and forth, and it creates radial shock waves that kind of break down that thickened tissue. It's almost like a meat tenderizer. I usually start with the initial ultrasound evaluation. That's what makes me realize I need it. I do these weekly for 3 to 6 weeks. If it's less than 6 months, usually 3. If it's over 6 months, usually 6. 7 to 10 minutes to each area, and you want to avoid any anti-inflammatories. We have focused and radial, so I'll talk about that in a second. That's going to help repair the injured tissue, and then after that, I see them in 6 weeks, at which time they go to physical therapy, and then we kind of re-see how things are doing with the ultrasound. So that's kind of how I do that with that. I also have something called focus shockwave. This is another type of shockwave machine. This one up here, and it uses electrical waves, and it stimulates microcirculation, growth factors, and stimulation of your own stem cells. So that's how that kind of works in there. Okay, that's going over some shockwave things. Let me go back up here. Look at all these slides. If you want to look at all these slides, you can, but I don't want to go over those in too much detail. Okay. Okay, here we go. So we were talking about the shockwave. There is another type of injection that I do at times called an amnio injection. It's amniotic injection that stimulates your own stem cells. And then at times we do orthotics. Okay. If you want to get these, all these slides, I'm going to put the slides underneath it because this is where I usually end the presentation. Okay. But if you want to go after, then you'll see the actually replica with a lot of common questions that my patients give me and a lot of other resources that you can have this. This is what I do for my patients. So let me just show you kind of how I do that. So the link goes to this thing called my patient presentation tool. This is what I use for my patients. And then if you go down to plantar fasciitis, right here, you can see the slides. There's a link up top where you can get the treatment sheet, and then you can kind of go through and slide through. These are the same things I do in my office. So if you are a patient, you can actually print out the treatment sheet and bring it to your doctor. You could show them this presentation. That might help. Or if you want to come and see me, I'd be happy to see you. I'll put some of these links underneath. Hope this was beneficial for you. Okay, thanks.